Hello and welcome. I'm Angela Ballantyne, and this is a short introduction to the principles of inclusion and exclusion and how they relate to research ethics. Today, we're just going to focus on discussing the purpose of inclusion and exclusion criteria and the problem of unjust exclusion in research. Now, there's lots of international research regulations, law, policy and guidance, and that can vary from the international level to the national level, even the state, and sometimes there's policy at your local institution as well. So for the purposes of clarity today, I'm going to draw primarily on the International Ethical Guidelines for Health-Related Research Involving Humans. This is a document prepared by the Council for International Organizations of Medical Scientists, a long name, in collaboration with the World Health Organization. And this guidance was updated in 2016 and is really one of probably the most comprehensive pieces of work on research ethics internationally. So it's a good starting point for these kind of broad discussions. So let's start by talking about the purpose of inclusion and exclusion criteria and how they relate to ethics. Can seem at first glance that exclusion and inclusion criteria are very much about the scientific validity of the study, the scientific methods, rather than the ethics. So I want to explain how those two things are connected. So we can start over here at the end of the series of questions by thinking about, when you invite a participant to join your research study, one thing that you should be considering, and certainly the IRB and the Research Ethics Committee will consider, is whether it's legitimate and justified and appropriate for you to ask participants to take on the risks and burdens associated with research participation. And part of that assessment is whether the risks and benefits are proportional and appropriately weighted. The answer to this question depends on whether the study is going to generate socially valuable knowledge. It's not just dependent on that, but in part dependent on this question, because if the study is not going to produce knowledge that will inform the clinical care of future patients, then it's never okay to ask people to take on the risks and benefits associated with the research. And whether the study will in fact generate socially valuable knowledge depends on the scientific integrity and the validity of the methodology that you're employing. And this brings us to inclusion and exclusion criteria. Inclusion and exclusion criteria serve one purpose, which is to reduce noise in the study. So they allow the researchers to hone in and identify critical features that are impacting the outcome. And so you might want to exclude certain populations because you think that that will generate too much noise in the research, but equally you might want to include certain populations where you think they're a really necessary population to study in terms of producing socially valuable knowledge. So that's how the science of the study relates to the ethics of inclusion and exclusion. The second purpose of inclusion and exclusion criteria are to protect certain potential participants from harm. And it brings us to a sort of tricky balance around protecting participants, but equally not excluding certain groups from research. So for example, two groups that we might be concerned about protecting are older adults and pregnant women. I'll use those two examples here for discussion. So in relation to older adults, one reason they might be excluded is because older people tend to have higher rates of comorbidity, might be having polypharmacy for a range of different conditions. And again, those comorbid conditions and the medications that patients are taking generate noise in the study, and that makes it more timely and more complicated and more expensive for researchers to conduct the study when participants from those groups are included. I was looking for an image of an older adult over 65. This is a wonderful image produced during COVID 2020. Some of you might be familiar with the challenge of encouraging people to recreate famous images while they're at home. And this is an image of Florence Grewal imitating a painting by Paul Gauguin, and she's from Canada. So older adults are one group that we might, and that actually often are excluded from research. Second group that are often excluded from research are pregnant women. And again, typically justified on the grounds that research is risky, will involve interventions or protocols that are untested, that certainly the fetus is at a physiologically and developmentally vulnerable stage, and that it's often thought it would be unjustifiable to expose pregnant women and the fetus to the risks of participating in research. That view is starting to shift. There's been recent policy in the US looking at shifting that default and encouraging the inclusion of pregnant women in research, and I'll talk a bit more in a moment as to why that is the case. This example here, the probiotics and pregnancy study, is a study that I participated in when I was pregnant with our third child in New Zealand. Very low risk study, looking at the use of probiotics during pregnancy. So just to give you the example that there really, has been a recognition that harms can come from excluding participants from research. And that harm essentially occurs because populations that are excluded from research, even when that's done on the grounds of protecting them, still get sick. So older adults get sick, pregnant women get sick, they still need health interventions. And if we don't have a good evidence base based on predominantly clinical research to inform their clinical care, they will receive less safe, less effective interventions, often off-label interventions in the clinical context. So one way to think about this is if we exclude populations from research on the grounds that it's too risky, we don't make that risk disappear. Often we just transfer that risk from a kind of very heavily managed, well-regulated, well-governed research environment to a clinical environment that in fact might have a lot less oversight. And by that I mean pregnant women or older adults might need to receive medication off-label or interventions when there's not a lot of evidence to support that intervention in the clinical context if they get sick. So you can start to see that inclusion-exclusion criteria are quite a complex element of research. COM says that on balance, measures that are designed to minimize risk, and that would include, for example, exclusion criteria, certain population groups, need to be carefully balanced with competing considerations regarding the scientific and social value of the research and fair subject selection. So this brings us to the broader point about exclusion from research. So as I've said, it's problematic if certain groups are systematically excluded from research because it means we don't generate sufficient clinical knowledge to inform their clinical care. The issue of exclusion and inclusion criteria are really about deciding which populations are going to be outside the research and which populations will be inside the research. Those inside the research are exposed to higher levels of risk because they're being exposed to an experimental intervention. But equally, as a group, they may benefit if the clinical knowledge that's generated via the research is more applicable and more informative for that patient group going forward. So there's two considerations here. The distribution of the benefits and the burdens of research need to be fair. So again, citing COMS, in relation to the fair distribution of research benefits, they require that equity in the distribution of the benefits of research requires that research not disproportionately focus on the health needs of a limited class of people, but instead aims to address diverse health needs across different classes or groups. So historically, at least through one phase of research history, research focused predominantly on the needs of middle-aged white men and excluded ethnic minorities, as I've said, older people, women, and often children. So that's problematic because it means that the benefits of research aren't being fairly distributed within the community. But at the same time, there needs to be fair distribution of research burdens. So equity in the distribution of burdens of research requires special care to ensure that individuals, communities, or populations that are already disadvantaged or marginalised are not overrepresented in research. So we don't want certain communities to have to bear the burdens of research if they are going to be excluded from the benefits of that research. And one area where we might consider that this happens is the outsourcing of clinical research to low and middle income countries. Often that happens because it's more timely, it's quicker to do the research in those environments, because recruitment is quicker, because background health conditions mean that you have a larger population in need of medical care who don't have good access to clinical care in the health system, so are more prepared to join international trials in terms of accessing treatment, even if that's experimental treatment. So often outsourcing research from rich countries to low and middle income countries means the research can be conducted more quickly. Problem, however, is that if those populations are not likely to benefit from the research long term, that could be an unjust distribution of the burdens of research. So I hope you get a sense that inclusion and exclusion criteria are really important from an ethics perspective, not just from a scientific perspective, and that it can be quite a delicate balance ensuring that your inclusion and exclusion criteria are scientifically appropriate for the study, reduce noise in the study to the extent that you can produce a good, clean outcome, and you can produce socially valuable knowledge, but at the same time avoid overly burdening certain populations or unjustly excluding other populations. So it's complicated. So in summary, the ethical purpose of inclusion and exclusion criteria are to ensure that the methodology is scientifically sound, to protect potential participants from harm if they're deemed to be particularly at high risk, and also to ensure the fair distribution of research benefits and burdens within the community. We need to be wary of the risk of unjust exclusion from research, and historically this has related to women, people with comorbidities, ethnic minorities, certainly prisoners, and pregnant women. And this is a problem because it means there's a lack of medical knowledge to inform the clinical care for these groups. So thanks for listening. I hope you found that useful.